So this is our second event as we're testing out this Google Hangout, but so far it's been going well. The first event was actually on my end where I had to use my mobile device to record and get on air, but overall I think it's been a good 15-minute chat. Great learning experience for me to see what the folks are doing out there. The last two episodes has been primarily focusing on the M Health.
Mm.
So perfect time for you to dive into as we talk about the consumer world as we move towards that consumer health, um, on-demand consumerism in healthcare. I think this is a great thing that we're talking about. I'm a big believer in terms of where healthcare is headed towards in that direction. So um, why don't we get started? Well, thanks everyone for joining. This is David Chou. I'm here with Alexander Börve from First Derm. As I was mentioning earlier, we're moving into that era of, I want to call it telex as a service, because almost everything that we're doing these days is going to be involving video, is going to be involving technology. So as we evolve towards that telemedicine space, there's going to be lots of specialty services that's going to be coming out and playing. And I think dermatology is just such a big one and such a great one to be involved with and leveraging the latest technology. I personally have been using my so-called teledermatology, where I just take a picture, send to a dermatology specialist just for a quick checkup. But there's a lot more to that. There's a lot more integration that can be involved. So without ado, let me introduce Alexander Börve, the CEO at First Derm. So Alex, why don't you tell me a little bit more about yourself, your organization, and some of the things that you guys are working on?
Yeah, so my background is I'm an orthopedic surgeon. I'm not a dermatologist. So the story behind this is in Sweden, when I was doing my residency in orthopedic surgery, I was a lot in the ER, and we would get ambulances coming in with car accidents and so forth. And at that time, everybody had like a cell phone, but there were no apps or anything like that. So I had the idea that instead of the ambulances reporting just by telephone saying that they're coming in with 2 or 3 people who are injured, they would take a photo of the car accident scene so that we in the ER, we would get some indication of how much energy and trauma was involved in that accident. This was very difficult to implement into the healthcare system. At that time, my peers, they didn't really understand technology. So I had a girlfriend who was a dermatologist, and she experienced exactly what you said there, David, that she would get photos sent from her friends and family, and she telling them what it is. And she also experienced this at dinner parties when she was there, and people would say, "Oh, you're a dermatologist. Should I really go in to see the doctor because of this rash or this mole?" And she felt that, this was her time off, and she couldn't really give a good response. So she came back to me that evening and said, "Look, maybe that's a service which you're doing for paramedics, you should pivot that into dermatology." And as we also know today, the dermatologist, the first step to learn dermatology is actually from textbooks and images. So basically, we're doing exactly the same thing. A dermatologist having a look at an image and giving their opinion or their answer from that. Obviously, they can't say on every single image what it is. So that's where my research has shown. I've written 4 scientific papers on this technology, has shown that
Ooh, looks like we may have lost Alex for a little bit. We'll give Alex a few moments while he's trying to join back in. Yeah, some of the big challenges regarding the telespace is, the bandwidth is key. It's the foundational element in terms of getting any sort of service to work. We take it for granted as far as having connectivity. So as you can see, we cannot always have that. So that's one of the basic fundamental elements that we must have, is having the connections.
Yes, so I'm on here.
No problem. Welcome back.
Where I draw, dermatology is a great service for triaging users.
Great. Well, that's
Did
a
you catch that?
yep. We got that. That's a that's exactly where the needs are. And I think from your standpoint, you guys saw a need, and which is how it started. So it sounds like a great thing. So one of the things I've always, one of the things, the main drivers in healthcare, and a big stumbling block as far as why services are not extended or are not taken upon is we always talk about reimbursements. How do we get reimbursed for providing this service? From the teledermatology standpoint, how has that impacted your business? How has that impacted just the telex space arena, that's what you have seen?
That's an interesting point where you bring up there. I mean, teledermatology, it basically started in the early 90s. That's when you had dermatology, and it's quite a surprise that it's not rolled out over these 25 years to every single hospital. And it's exactly what you're saying, that doctors are not getting paid, and also also a lot of people, trusting technology like this. It's a new form. It's instead of going to see a doctor, which you've always been used to do, how can technology help you in this way? So the 2 points there, it's the reimbursement, and then also is the adoption of people who prefer to use technology in this way instead of going to see the doctor in person.
Right, great. And obviously that convenience factor is a big driver for everyone, especially consumers, as we live in this on-demand world these days where we want access now. Every vertical that we live in, we want access now, right? You want your valet parking now, so you're going to find a service that's going to offer valet parking through an app. You want your Ubers, you want your Amazon Prime delivery. So it's moving towards that on-demand world, and that's a great thing that you guys are putting together. So if I were to look at this space, I know we're primarily focused on the U.S. Population, but I was abroad for almost 3 years in Abu Dhabi in the UAE, so I saw how healthcare is provided a little bit differently internationally. What do you see as the differentiator between U.S. healthcare versus what's going on in the global scene, specifically in the telederm world, and especially the telemedicine world?
So we can compare we can compare the U.S. and Europe right now. So Europe, they have a socialist healthcare system. That means healthcare is nearly free. You might just pay $10 or $20 to go and see a doctor. However, as a patient, you are put on a waiting list. It's not that you can get a dermatologist anytime you can, just because you have more money or things like that. There in Europe, they kind of more using the resources that exist, prioritizing the patients to go and see these doctors. In the U.S., it's more of a capitalistic system that the doctors, they want to earn as much money as they can, as that is more so that they can have a viable living. Because I know also, for example, here in medical school, when you become a doctor, you end up with about $500,000 in debt. In Europe, becoming a doctor is basically free. It's still 6 years and 9 years if you want to become a dermatologist, including medical school, but you don't come out and have a debt of $500,000. So that's basically the difference in how the two systems differentiate between America and Europe. Now, obviously, in Europe, I know in Italy, for example, they have 12,000 dermatologists. And if you look at the UK, they only have 450 dermatologists. But the population sizes are very comparable. Sweden, you only have 9 million people, but you have 450 dermatologists. In the US, you have 300 million people. So it's can make this more efficient. And now it's just up to that dermatologist that they can and they want to do this kind of a triaging in dermatology system. And what we found from our research and also our service is that we're not taking any patients away from the dermatologist, but we're curating the patients that come into the dermatologist's office, and where the dermatologist can actually be making more money on the patients that we send to the dermatologist's office. An example is you have a pimple on your nose. A pimple on your nose, you don't need to go and see a dermatologist. You can go to the pharmacy and buy over-the-counter medication. However, if you have something that looks like skin cancer, then you should go to the dermatologist as soon as possible. And also that patient that goes to the dermatologist with skin cancer, the lifetime value of that customer for the dermatologist is about $7,000, because that patient will not only come in and have treatment on the first visit, but they will come back every single year the rest of their lifetime.
Perfect. Well, one last question. I'm going to have to start getting to some of the gadgets that's involved, because obviously as we move in that telemedicine space, folks are going to be using a wide variety of mobile devices in terms of that video technology for interaction. Personally, I have seen a big difference in terms of camera quality based on the type of devices. So on the iPhones versus their competitors, whether it's Samsung, HTC, or some of the other players, I do see some variations in camera quality. How much of that is that going to play in your world? Do you see? Are you guys moving towards a standard and at least a recommendation for the types of devices that folks are going to use for that interaction? Do you see that come into play?
So through my research, what we actually proved was that it was not the megapixels that made a difference in being able to read something from the images. It was actually the focus of the image. That was the most important thing. And even with our service today, sending over 5 megapixel images to our platform, the delay of sending those big images takes so much time, so the user experience is not a very nice experience. So we actually compress those images to 1.3 megabyte. So the only data we send is 1.3 megabyte and not 10 megabyte, making the experience much better for the user. And also our dermatologists, they don't notice. I already tested it with them. I tested 5 megapixel images with 480 times 620 pixels, and the outcome of the answer is still the same.
Great. Well, that's good to hear, especially as we move towards that technology era. It's not going to be device agnostic. So, one last thing. Anything else you want to share before I let you go? Really appreciate your time, Alex.
No, I think thank you very much for having me on your show. It was very nice meeting you, David, and